Hello, I'm Dr. Alicia Power,
And I'm Dr. Maria Kang, and welcome to Growing Healthy,
a podcast about pregnancy, pediatrics, and beyond.
Dr. Kang and Dr. Power take care of both pregnant women and their babies, but we gotta start somewhere. Are you thinking of getting pregnant? Well, this is the podcast for you.
Generally, women and their partners have quite a few questions about how to get their pregnancy off to the healthiest start. Right after this little reminder. The Growing Healthy podcast and website is meant for general medical information only. This does not apply to every situation, and should you have questions or if you have received different advice, please contact your healthcare provider.
The views expressed by Growing Healthy and our guests are not representative of any institution with which you are affiliated.
So let's get started. Preparing for pregnancy.
Okay, Alicia, what are your recommendations for eating in pregnancy?
Great question, Maria. First and foremost, I think eat real food. There is definitely some evidence out there that the diet you're eating around the time of conception can influence how your body actually diverts its energy to your placenta. So make sure you're eating a well-balanced diet of real food. Start taking a prenatal vitamin as soon as you find out you're pregnant, or better yet, when you start thinking about getting pregnant. Maria, what about exercise?
Exercise is good. Anything you've been doing, keep doing. 30 to 45 minutes, 3 to 4 times a week. That sounds like a really lofty goal, though, to me.
Well, that's what we recommend for everyone.
I think that's an excellent goal.
Just do your best.
Okay.
When it comes to alcohol during pregnancy, there's no safe amount of alcohol during pregnancy that we know of. Maria, what about your thoughts on alcohol during pregnancy in terms of its effects on baby?
Okay, you're absolutely right. Most people have heard of fetal alcohol syndrome or fetal alcohol spectrum disorders like FASD. And there's a broad range of effects to the baby, including your general size, brain size, development, learning disorders. These are lifelong problems that can affect the baby, your child, for their whole life. There is no safe amount or safe time during the pregnancy to drink. Sorry. And before you ask about all those women in Europe who drink during pregnancy, okay, there are consensus guidelines out there, which means that even in European countries like France and Italy recommend avoiding alcohol during pregnancy. I looked into this, and Bulgaria and the UK have come out with the guidelines of no more than 1 to 2 units of alcohol once or twice a week. They still say that if you're pregnant or trying to get pregnant, you really should avoid alcohol. Probably has more to do with like harm reduction and public health strategy, but bottom line, the earliest intervention we can promote is a healthy pregnancy, and this starts with avoiding alcohol.
So, great information, Maria. We've talked about alcohol. What about other drugs? Both marijuana and the more illicit drugs such as cocaine, heroin, etc.
This is a big topic. Okay, drugs like heroin, cocaine, ecstasy, all that complicates your pregnancy. It compromises blood flow to your baby. You were talking about the flow to the placenta previously. So this means that your baby could be very small and premature. Plus, the smaller and earlier your baby is born, the more problems it can run into during those critical first few days and few weeks of life. This can really affect brain development down the road. Another major problem immediately after babies are born is withdrawal. Babies will actively withdraw in the same way that adults do. They're sweaty, they have high heart rates, diarrhea, they can even have seizures. On top of that, withdrawing babies spend less time with their moms, having difficulty feeding and hard to manage, even for very experienced moms and caregivers. The big question of marijuana, Mary J. They haven't really teased this apart as much as heroin and cocaine, but it's known as the gateway drug. This means that it easily paves the way for more illicit drug use. I think this is why the research is difficult to perform and to analyze, because there are not as many moms who are just using marijuana. But the bottom line is avoid illicit drug use. But more importantly, if you are struggling with a drug and or alcohol problem, please just get help. There are so many programs for pregnant moms who are struggling, and it's not about taking your baby away. The more you seek out help and work at it, the baby will be better and you will be better for it. So get on board with a maternity care provider that you feel good and connect with, and reach out to the Addictions Outpatient Clinic. It's out on Pembroke Street if you happen to live here in Victoria, BC.
That's great advice, Maria. And I know I say to pregnant women, because there's a lot of women in our society who are using marijuana for a variety of reasons, that we don't necessarily have all that much great research on the effects on a little baby, but we do know that it can affect teenage brains, which are rapidly developing and increase the risk of psychosis. So, if we can extrapolate that to little baby brains, which are also rapidly developing, and most women who use marijuana wouldn't offer it to their baby when their baby is born. And so that's something to think about during pregnancy.
Yeah, and I don't discount that it's hard. I mean, life is hard, and we just want to do what's best for our babies. So whatever point you're at, it's just about making good choices one day at a time, and I can definitely appreciate that. So, well, Lisha, what about other health conditions? Like, what do you normally counsel women on?
Well, I think it's really important if you do have a medical condition to make that condition as stable as you can prior to getting pregnant. Some examples of diseases that should be stabilized are diabetes, either type 1 or type 2, seizure disorders, bowel problems like Crohn's or colitis, hypertension, kidney disease, and especially depression and anxiety. You need to tell your care provider as soon as you think you may start planning on getting pregnant. Certain medications are safer than others in pregnancy, and so there may be a decision to change your medications to plan for pregnancy, and this can sometimes take a little bit of time to stabilize. Many people are on antidepressants and often ask the question about whether they should stop their medication prior to conceiving. This is a very complicated question with no easy answer. But the most important part of the answer is that a stable mother is always the most important thing to work towards. So talk to your care provider about it. If they're unsure, they can always ask somebody who does a lot of maternity care for some advice around this. And certainly the docs at Grow Health, which is where I work, are always happy to see women before they get pregnant to discuss issues around getting pregnant. So if you don't know the answer, or your care provider, who doesn't necessarily do a lot of maternity, doesn't know the answer, then ask for help. Book an appointment with a care provider, and depending where you live, your options will either be a midwife, nurse practitioner, family doctor, or obstetrician. In Victoria, BC, certainly the options are a midwife or a family doctor. And then ask those questions about what you should be doing to work towards a healthiest start to your pregnancy.
That's a really good point. Like a couple weeks ago, I got a call from a family doctor in town who doesn't do maternity care. And so she had some questions about antidepressants during pregnancy. And, it's just a good reminder that there are some people out there with good expertise, whether that's your family doc or your midwife or obstetrician. But there's no easy answer there, right? It's something that you have to discuss with your care provider. So I think that's also a great thing to keep in mind. There's so many resources out there. Maybe Google isn't always the best resource, but having that conversation with someone with good experience, I think, is a really, really important thing. Okay, well, there are dads usually involved here, so and they like to play a role in pregnancy and being on the same track as your future moms, eating healthy, exercising, stop smoking and drugs, and minimizing alcohol is always a good rule of thumb for the dads out there.
Well, Maria, should we get down to the nitty gritty of things?
Let's get down into the nitty gritty. Okay, what do you tell people about? Do we want to do this?
Yeah, totally.
Okay, okay. Let's. How do you get pregnant? I didn't know we were going to get into that, but let's do it.
I get into this because a lot of people, not everybody, but don't actually understand their menstrual cycles and how to get pregnant. They
Yeah.
haven't been taught this in school, they haven't taken health education, and it's an important thing to know because I have women coming in and talking to me about how come they're not getting pregnant, but it's just because of the logistics of it. So, most women have a 28-day cycle. This starts on the first day of your menstrual cycle and ends on the day before your next menstrual cycle. Most women ovulate around day 14, and generally the egg needs to be fertilized within 24 hours. Sperm can be useful for up to 5 days, but the egg needs to be fertilized within that kind of 24 to 48 max. So I usually recommend that partners have intercourse on day 14, 2 days before that, and 2 days after that. So we're looking day 12, day 14, and day 16. If you really want to hedge your bets, then you could add in day 10 and day 18 as well. The reason we use about 48 hours between intercourse, is to allow for the man's sperm to reaccumulate to a reasonable number. So the majority of people with consistent trying at the appropriate time will be pregnant within 6 months of starting that kind of trying to get pregnant. Now, as we know, age can play a factor in both fertility and in terms of increasing risk of chromosomal abnormalities or abnormalities with the actual genetic material of your baby. And so, if you're under the age of 36 and not pregnant by 6 months, it's a good idea to seek care from your healthcare provider. But if you're older than 36 months, I usually recommend starting that conversation around 3 months of trying without getting pregnant. Any questions around that, Maria?
I don't have any questions, but I am a pediatrician, and most of my recommendations always involve a sticker chart. I totally see a calendar and a sticker chart here. Would that be
With gold stars or
with
happy faces?
either or? I mean, depends on how you're feeling, but I'm envisioning a calendar here with stickers.
Now, I think on that note, it is important to remember that when we get stressed about things, we don't
Mm,
necessarily ovulate. And so make sure you're having fun with this. This is not a job. This is should be an enjoyable time in your life. So relax when you're trying to kind of do this. Don't get too stressed about the logistics and the details of it because that will increase your ability to ovulate and therefore get pregnant.
that's a good point.
Now, one issue that has come up recently in the news and with people asking me is Zika virus. So, Maria, what's the latest on Zika virus and trying to get pregnant?
Okay, so first of all, Zika virus is rampant, and so just because we live in North America doesn't mean that we are immune to this virus. Remember, we live in a global universe. I mean, people are traveling all the time. So, the current recommendations are that women consider a delay in conceiving a child for 2 months, and that a male partner delay conceiving a child for 6 months after returning from travel to a Zika virus affected area. You can look on the CDC website, they're always up to date in terms of which areas are endemic with Zika virus.
Another important thing to note, which is not about getting pregnant, but if the woman is pregnant and her partner were to travel to a Zika affected area, they should certainly either abstain from intercourse for 6 months or at least use a condom to help prevent that possible transmission after the pregnancy has actually started. Well, I think that about wraps it up for our first podcast, Maria. How do you think it went?
Yeah, that was really interesting. I think it will get better and better as time goes on. We've got lots to cover. I mean, pregnancy, gosh, is 9 months of pregnancy, so we can,
And 18 years of pediatrics,
it's good times
and then the rest of your life.
forever and ever.
We'll see you soon.
Stay tuned.